Hello everyone, my name is Dr. Pradeep Shinoy. I'm your MRCP Part 1 course instructor. Now we are going to discuss series of cases and how to approach individual cases. Now question number 1, we have a 45-year-old male with a history of alcoholic liver disease who presents with increasing confusion. On assessment, he is noted to be obtunded with Glasgow Coma scale of 14 out of 15 and has a wide-based gait and a nystagmus. There is no history of recent trauma. What is the most specific finding in the MRI brain in this patient? So if you look at this question, the question has about 4 sentences, and at the end, the question is asking about the investigatory findings. It's not about the diagnosis, it's not about the etiology, it is not about the treatment, it's asking about investigation. So sometimes if you read the end, the last sentence, it will be useful to know what questions are the particularly being asked on that topic. So discuss from the beginning. So we have a KA patient who has an alcoholic liver disease who is presented with confusion. So when we have an alcoholic liver disease who is presented with confusion, there are only 3 or 4 differentials which come in the MRCP exam. The first and the commonest is usually hypoglycemia. Second, it could be hepatic encephalopathy. Third could be hyponatremia. So these are the 3 common differential diagnoses for altered sensorium in a patient with alcoholic liver disease. Now, the clue to the question relies on the additional symptoms. The patient has a wide-based gait and an nystagmus. So, wide-based gait indicates that patient probably has an cerebellar involvement and probably has additional nystagmus. So, it has got generalized probably cerebellar involvement. There is no recent history of trauma, and so it rules out few of the options which have been provided. So let us discuss individual options. So if you have a left-sided subdural hematoma, that means the patient usually has a focal symptoms on the opposite side, which is not the case here. Generalized cerebral atrophy is usually a chronic condition. So here the patient is presented with acute history of altered mental status. Hydrocephalus, we do not have any history to suggest raised intracranial tension. There is no history of preceding infection, so it's less likely. Then we have enhancement of the mammillary body. Now this is a finding which is commonly seen in Wernicke's encephalopathy, which is characterized by global confusion, ophthalmoplegia, and ataxia. Now that's what we are seeing in this question. The fifth option is right-sided cerebellar infarction. If it was a right-sided cerebellar infarction, we would have the patient who should sway towards the right side, which is not the case. So the answer for this question is option number 4, where we are finding an enhancement of the mammillary body, which is suggestive of Wernicke's encephalopathy. Thank you.